Assalamualaikum and hi. My name is KHADIJAH binti SAAFIE and today I'm going to talk about one of the medical specialty and that is nephrology. When we talk about nephrology, what first comes out of your mind? Basically, nephrology is a subspecialty of internal medicine that looks into all kinds of kidney conditions, delivering the necessary treatments and solutions. Its primary goal is to improve and preserve the health of our kidneys, helping anyone with kidney diseases to overcome them and regain vitality. Who's going to do it? Of course, the nephrologists. Nephrologists have the deep training and knowledge to not only diagnose and treat kidney diseases, but also other complications this kidney disease may induce. Dr. Manju Anggarwal is one of the best nephrologists in the world. She holds an MD, a DNB in nephrology, and an MBA. She is the Director and Chief of Department in Nephrology at Artemis Hospital, Gurgaon, India. She wants a fellowship in nephrology at University of Minnesota Hospitals and Clinics. She is a chairperson and member of various hospital administrative committees. Let's move on to anatomy of kidney and nephron. In humans, the kidneys are located against the back muscles in the upper abdominal area. The kidneys are two bean-shaped organs, each about the size of a fist. For your information, each kidney consists of a million microscopic structure called nephrons. What is nephron? Nephron is a functional unit of the kidney that responsible for filtering blood and forming urine. Nephrons are found within renal cortex and renal medulla of the kidney. Each nephron consists of Bowman's capsule, glomerulus, and renal tubule. Bowman's capsule is a cup shape that contains glomerulus. Glomerulus is a cluster of blood capillaries that form from the afferent arteriole. Its primary function is filtration of blood. Renal tubule composed of proximal convoluted tubule, loop of Henle, and distal convoluted tubule. Proximal convoluted tubule located in the renal cortex and highly coiled. It involves in reabsorption and secretion during urine formation. Loop of Henle consists of descending limb and ascending limb that involves in the reabsorption of water and salt. Distal convoluted tubule have the same characteristic and function as proximal convoluted tubule. Collecting duct is a series of tubules and ducts that connect the nephrons to the ureter. It involves in the reabsorption of solute, urea, natrium chloride, and water. Next, let's dive into the formation of urine. There are three main processes involved in the formation of urine, which is ultrafiltration, reabsorption, and secretion. Ultrafiltration is the mechanism whereby interstitial fluid is formed as blood flows through other capillary networks in the body. Reabsorption is recapture of useful substances from filtrate in the renal tubule to interstitial fluid, then back into the blood capillaries. Secretion is the removal of unwanted substances from blood capillaries, interstitial fluid, then into the renal tubule. Let's look at a video to understand more about the urine formation.
The kidneys filter unwanted substances from the blood and produce urine. There are three main steps of urine formation: glomerular filtration, reabsorption, and secretion. Let's go through each one. Each kidney contains over 1 million tiny structures called nephrons. Each nephron has a glomerulus which filters water and other substances from the bloodstream and has a network of capillaries surrounded by a cup-like structure known as the glomerular capsule. As blood flows through the glomerulus, blood pressure pushes water and solutes from the capillaries into the capsule through a filtration membrane. The filtration membrane blocks blood cells and large proteins, allowing these components to remain in the bloodstream. This begins the urine formation process. The glomerulus filters water and small solutes out of the bloodstream. The resulting filtrate contains waste along with other substances the body needs: essential ions, glucose, amino acids, and smaller proteins. When the filtrate exits, it flows into a duct into the nephron called the renal tubule. The needed substances and some water are reabsorbed through the tube wall of the renal tubule into adjacent capillaries. This reabsorption of vital nutrients from the filtrate is the second step in urine creation. The filtrate absorbed in the glomerulus flows through the renal tubule, where nutrients and water are reabsorbed into capillaries, while the waste ions and hydrogen ions pass from the capillaries into the renal tubule. This process is called secretion. The secreted ions combine with the remaining filtrate and become urine, which then flows out of the nephron tubule into a collecting duct, passing out of the kidney through the renal pelvis into the ureter and down to the bladder.
Now, I want to talk about 4 common diseases related to kidney. Firstly, chronic kidney disease, which is the CKD. CKD means our kidneys are damaged and can't filter blood the way they should. The main risk factors for developing kidney disease are diabetes, high blood pressure, and a family history of kidney failure. Secondly, acute kidney injury or AKI. AKI occurs when kidneys suddenly lose their ability to filter waste from the blood, developing within hours or days. The signs of AKI can differ depending on many factors like the causes, severity, and our health conditions. Thirdly, nephrotic syndrome. Nephrotic syndrome is a kidney disorder that causes our body to pass too much protein in our urine. It is caused by the glomeruli in our kidneys. When damaged, glomeruli allow too much blood protein to leave our body. Lastly, kidney stones, or we can call it as nephrolithiasis. Nephrolithiasis refers to the presence of stones within the kidneys. Stone formation occurs when there's an excess of crystal-forming substances that can't be dissolved in the urine. I believe that with every sickness, there is cure. Hence, let's look into the treatments and technologies. In this modern era, there are lots of treatments and technologies we can use to treat kidney diseases. However, I will only talk about medication, dialysis, kidney transplantation, and artificial kidneys. Medications are tailored to treat underlying causes or manage symptoms. For example, steroids or immunosuppressants is a medication that treats glomerular diseases such as glomerulonephritis and nephrotic syndrome. Diuretics can reduce fluid retention and manage swelling such as furosemide. When nephron function declines severely, dialysis replaces kidney functions. Hemodialysis is a process when blood is filtered externally using a dialyzer machine. It removes waste, excess fluid, and toxins. Typically performed 3 times a week in a clinical setting or at home. Peritoneal dialysis is also one of the examples of dialysis. In cases of end-stage renal disease or ESRD, a kidney transplant is a definitive treatment. A healthy kidney from a living or diseased donor replaces the failing kidney. It requires a lifelong immunosuppressant medications to prevent rejection. Development of wearable artificial kidneys or bioartificial kidneys is ongoing. Wearable artificial kidney is a portable dialysis devices that's still under development for greater convenience. Bioartificial kidney combines filtration technology with living kidney cells to mimic natural kidney functions. These are the sources that I use in doing this research. That's all from me, and if you have any inquiries, please do PM me via this email. Thank you and have a nice day.